All right, let's take a look at how to do rectal insufflation. And we're here with Princess Buttercup, and we're going to show you how to do that right now using the Hummingbird ozone generator. If you have a different generator, that's fine. You'll just have to change things up just slightly on concentration, flow rates maybe. We have our oxygen tank on the back here. If you need to watch videos on how to use those things, we have other videos on that. This is just on the treatment method itself. So what you're going to need is a syringe, or I have here as well an insufflation bag. So if you have a larger animal than Buttercup, she's about 60 pounds, so we don't need anything more than a syringe today. But if you have a larger animal, you can use an insufflation bag. It just kind of speeds up the process because you can fit a lot more in these. And so that's possible. But if you do that, for example, with our Hummingbird ozone generator, as it fills, you don't know exactly how much is in the bag because it's flexible and it doesn't show exactly. So you need to know how much is going into that bag. So for example, with this, if we set the flow rate at 1/4 liter per minute, which is what we'll use on our Hummingbird ozone generator, and we needed 250 milliliters, that would be a pretty big dog, by the way, then we would run this for a minute, and we would have our 1/4 liter in here. If we need half that, we'd run it for 30 seconds, and we'd have 125 milliliters in here. So basically, you just need a countdown timer, stopwatch of some sort. This is provided with our ozonation station cart, and you can calculate how much is in the bag just based on how much time you've produced ozone for. We're not going to need that today. We just have our syringe, and we're going to fill that. We have our 3-way stopcock connected. We have a destruct in here that's connected. There's various setups for this, so you can go watch those videos at a later date. We're going to turn our generator on. We're going to turn our oxygen on. You can't see that, but I'm going to set it at 1/4 liter per minute. And right now, it's off to our exit port up here, so we're just producing ozone. That ozone's running into our destruct. When I'm ready to draw ozone into my syringe, which is after about 10 seconds, I'll let it run for 10 seconds. That'll get pure ozone into the reactor and ready for me at full strength to draw it up into my syringe, which is, on this generator, 33 micrograms per milliliter is what I'm going to be getting. So I'm going to go ahead and flip my 3-way stopcock so that it fills my syringe. I need to fill the entire thing with Buttercup, and that's our minimum protocol, is about 1 ml per pound. So I'm going to let it fill up to that and then turn it off to the syringe. It's running now through the destruct again, but that's all I need. I'm going to turn my oxygen and generator off at that point and take my syringe, tip it up. Ozone's heavier than air, so it'll stay in there. I'm going to connect my catheter next, and then it's good to lubricate the tip of your catheter. So I'm going to just use what I have right here with me, which is my ear oil, ozone ear oil, and just put a little bit of that on there, and that'll make it a little bit easier. And we're just simply going to take that to our patient. Good girl, Butter. And we're going to infuse that. You really just have to put it in about, good girl. That's okay, that's okay. There. About 3 inches or so. It's okay. It's okay. And then just infuse it. So I infused it pretty quickly. You couldn't even see me do it, but I did that. I'm going to tip Buttercup back down. And of course she's jumpy for the video. That's all there is to it. Now I can take this syringe and reuse the syringe, and I can take the catheter, I can actually clean that and reuse it for her. There's another video on how to do that. Tuck the tail, or have them sit for about 30 seconds to make sure that ozone fully absorbs. And then I'd recommend letting them outside to see if they have to use the bathroom. Sometimes they will, sometimes they won't. If you have one person doing this, you can do it. It's easier with 2 people. And if at any point in time that's not working for you, try to distract them with something. Use a Kong with peanut butter, something they like, to try to get this process done. It's pretty simple and pretty fast. Once they understand it, they should tolerate it pretty well though. So, all right, that's it.